Dr. GSK Velu, do you think India is ready to allow its diagnostic labs to conduct the vaccination drive, especially in rural areas, especially in areas where the kind of facilities that Jason Doshi talked about aren't really available, and it might take a little bit of time to even make them?
I think it's a very no, brilliant question because, for example, today vaccine hesitancy is one. Then we have gone into vaccine shortage. Now we are talking about mass vaccination. So when we are going into mass vaccination, we need multiple vaccination drives. And these pathology labs, particularly, they have presence across the country in every, particularly the larger ones, which has good cold storage facility and well-trained phlebotomists. I think all the phlebotomists can be trained, and probably they can supplement with nurses and medical assistant along with telemedicine. So that I think the vaccination, I don't think any amount of effort is not enough. If we have to, still we need to actually vaccinate 1 billion+ people. So if that is the case, which we need to really involve, not only we are talking about in testing, for example, we need to also really focus on rural testing. While government has done whatever they could, moving forward, we need to start using mobile labs. We cannot wait for 24 hours, 48 hours for testing. By the time the person is going and spreading the infection to other people. So using technologies like mobile labs in villages is important, and use those mobile labs also to do vaccination, and also actually have some of the collection centers, well equipped collection centers of pathology labs can become vaccination centers, because of thousands of them of large pathology players. They can become qualified vaccination centers. Of course, they need to follow certain minimum norms, and they should be able to have a doctor available who can be attending to the immediate needs of the patient. So I think pathology labs will play a very huge role in vaccination. As of today, it is not allowed. It's only hospitals have been allowed to vaccinate. But I think even from our side, we have represented pathology labs should be given the permission to do vaccination. Then home vaccination is another thing. I think that also should come, as long as we should promote everything, as long as that can be controlled, and it can be done by qualified people with certification. So if these things can be done, and as Dr. Bagai said, another panelist said, it is basically we need to support the central government. Central government has done it for decades. So if they come up with correct guidelines, every state can follow it, tweak it little bit, but everyone cannot follow and create their own rules. If the central guidelines comes, then only the mass vaccination becomes a reality. I think pathology labs will be happy to play a role, and these things like mobile labs, going home and vaccinating. I think in the US they started even home vaccination, I hear. So many of these we need to also start doing it. If we have to really, we are talking about vaccinating 90 lakhs to 1 lakh 1 crore person per day. Currently we have reached 30-40 lakhs per day, so we have to double triple this speed in the next few months. I think government has this whole concept of vaccinating most of the people by end of the year. So for that, I think the current speed need to really increase. I think any amount of help from qualified and organized players should be welcome, because today with the way
Okay.
government fixed that 150 rupees for vaccination, there is no money making in this. It's just a social service everybody can do, and all of us have to come together to do it, so that India can become COVID free next year.
Thank you very much, all of you gentlemen, for joining us here on India Health Mission.